I only do surgery on the face and neck, but I'm well aware of the issues of women's bodies after childbirth from my wife's own experience. For some people, they do need a little lift, and yet others may have 2 or 3 children and seem to hold up very well. Hike, kind of trying to get better at golf, another great challenge in life. My gauge of how I'm doing is how's my blood pressure, how's my physical exam, and my internist tells me that everything's perfect. So experience and the satisfaction of having what they want, what they may have always wanted in terms of their appearance, becomes very positive. It affects their outlook, and many people say it was one of the best things they ever did in their life. My job is to both make people happy and to look better. I don't want to fail. In other words, I don't want to have a successful surgical outcome and yet have the patient be unhappy. Cosmetic nasal surgery is appropriate for young ladies at 15 and older because they have a sense of self and understand that an operation can solve that one issue for them. You're rendered unconscious. Now, that does put you a little closer to death in reality. A cosmetic surgeon needs to market himself or herself. It's bad before surgery because it's a compromise of safe anesthesia. I like charity work. Most of the cosmetic surgeons that I know will do that work in some form. Smoking is bad before surgery because it's a compromise of safe anesthesia. The doctor has to be able to absorb the stress because it's not healthy for the rest of the staff in the operating room to become anxious. High-profile people, whether they be in the entertainment industry or in business, they'll often like to wear a cloak of eternal youth. They almost want to seem immortal. Maybe Beverly Hills has a bit more of this problem than other places, but some people here wish to go beyond what is already a good result. In other words, they look good and ought not to have anything else. I'm still learning how to give myself adequate family time, adequate learning time, and adequate business time. Developing a new procedure is a two-edged sword. Anything that new has to go through a trial period. And the problem in cosmetic surgery is you can't perfect these techniques in a laboratory. I like to work hard and I like to play hard. Take a fair amount of time off. I think that benefits me professionally. I always took time off when they were on vacation because I felt that was important, and I had the ability to do it because I could basically schedule my work to accomplish what used to require major procedures. Come in here and take some photos.
Okay.
Good. Easy, just like before surgery. Okay, I'll have you stand there, pretty lady.
Okay.
What do I want at this point in my career? And the answer is I want to have the same satisfaction that I've had for the last 27 years. And I could very comfortably finish out my career performing essentially the same spectrum that I'm performing now. And that would be nice.
I thought you told me that they were going to have an escalator here.
There is, but you have to have a pass. I'd like to have a well-rounded life. I don't want to be narrow. I've enjoyed traveling. I've enjoyed many recreational opportunities. If I had to define the 3 things I do in life, they are work, study, and have fun.